As South Africa marks Youth Day today, the continent also observes the International Day of the African Child, a day established in 1991 by the Organization of African Unity to honor the youth who led the 1976 Soweto Uprising. Now, the day not only commemorates their courage, but also highlights the ongoing challenges faced by African children, particularly in accessing quality education and healthcare. Among the pressing health concerns is a high number of children born with cleft lip and or palate. According to the World Health Organization, Ghana alone records an estimated 700 to 800 such cases each year, underscoring the need for improved maternal and child health services across the continent. We've now roped in Dr. Solomon Obiri-Yeboah, a senior specialist in oral and maxillo-facial surgery with Komfo Anokye Teaching Hospital in Ghana, and also a senior lecturer at the Kwame Nkrumah University of Science and Technology. Doc, thank you so much for your time this afternoon. So, cleft lip or palate conditions are treatable as we know it, yet many children on the African continent still go without proper care. Perhaps unpack where the gaps are in cleft care and just how severe the problem is.
Yeah, thank you very much for having me, and thanks to your viewers. Yes, cleft lip and palate is treatable, but there are a lot of other things, especially in Africa, that the children born with cleft don't get to receive. Among these includes access to care. In Africa, there are not many specialized people or surgeons who take care of these cases. And also the care is a multidisciplinary care because there are issues raised from surgery to nutrition to dentistry to orthodontic to pediatrics to speech and all that. So with all these issues that are associated with children born with cleft, they need a specialized professionals coming together to take good care of them. So in Africa, many centers don't do this comprehensive care, and that is a big gap. And most of the places is more of surgery, and even in other sectors in Africa is more depending mostly on missionaries coming to mission surgeries, coming to their centers to do surgeries. So this gap can be in multiple facets. Like I said, from financial to access to care to receiving quality, comprehensive cleft care, and even the social aspect, the psychosocial aspect, which is the aesthetic aspect of cleft care. And there are a lot of stigma with these children born with cleft.
Yeah. And I mean, when you look at those numbers, particularly just in Ghana alone, 700 to 800 cases each year, and to think that some of those children not having that particular access. I want to speak about what you've just mentioned now in terms of just the funding aspect. I mean, when we start looking at the challenges, how would then investment and funding, perhaps for the whole value chain, from surgery to training and even infrastructure care, contribute to building a more sustainable health system, not only in Ghana, I would imagine also in most parts of the continent?
Yeah, thank you very much. So there are certain NGOs that are helping cleft care in Africa, but notably SMITRAIN. SMITRAIN supports cleft care in Africa. And SMITRAIN is the largest supporters of cleft care in Africa. Their model is the model that we buy into, which is the teach a man to fish model that centers on building local capacity to take care of their own people. And I think that is more sustainable than just the outreach-based kind of care that people can do surgeries and then go back, mobilize, do surgeries, and go back. But the smart train model is to gather the specialist in his own local place, give him all the things, the tools that they need, and then support him to treat and give quality care to any child born with cleft.
Yeah.
So having this coming in to support infrastructure, building capacity, trying to train new professionals, all helps to build the local capacity to take care of their own children. I think this is more sustainable.
Dr. Yeboah, thank you so much for your time. Really do appreciate it, of course. So that is Dr. Solomon Obiri-Yeboah, a senior specialist in oral and maxillo-facial surgery from Ghana. Of course, speaking to us there about those staggering stats coming out of Ghana. In fact, the World Health Organization saying that Ghana alone records an estimated 700 to 800 cases of such cases, underscoring the need for improved health care in the region.